Okay, I did my project on fetus and fetu. Let's zoom in here some. So fetus and fetu is a rare congenital anomaly in which a non-viable parasitic fetus grows inside the body of its host twin. The parasitic twin is considered to be alive, but only in the sense that it has living tissues and can grow. The number of fetuses in fetus and fetu is typically single, however, multiple fetuses have been reported inside of the host twin. And on a side note, I read an article where there was actually 11 fetus and fetus found inside of one baby. So anyways, the parasitic twin usually lacks a brain and some internal organs. Therefore, it's unable to survive on its own. The host twin must provide a blood supply and nutrients to the parasitic twin. Here's just an example here. This specimen shows fairly well-developed fetus lying on its back. It's partially covered with skin, has intestines, and lower limbs. Let's see, causes. The exact embryogenesis of the fetus and fetu is controversial. There are two primary theories. One is that a fetus and fetu is thought to most likely be a type of monozygotic diamniotic parasitic twin that becomes enclosed within the body of its host twin during the early stages of pregnancy and development. The second theory, it's a little less popular, but it's also theorized that fetus and fetu may be a type of highly differentiated teratoma. Teratomas are tumors composed of tissue such as hair, teeth, bones, and other organs. Let's see. Criteria for diagnosis. There must be at least parts of one or more of the following present for diagnosis. Typically all of them have a vertebral column. Some studies say that is like a requirement, that it has a vertebral column, at least part of one. But it can also have parts of limbs, organ tissues, blood vessels, an amniotic type sac, partially or completely covered in normal skin. Symptoms, so, well, let's do treatment and prognosis. It's considered benign with rare malignant potential. The treatment of choice is total excision, since the mass may continually increase in size. This can also lead to hemorrhage in the host twin. Also, the mass can put pressure on the host diaphragm and cause difficulty breathing and potentially suffocation. This is more in cases when they're not diagnosed till later in life. It's been found in adults. I think one was 36 and the oldest known case is 47, and they were brought in because they were having difficulty breathing because the mass was just growing so large. But post-operative follow-up includes screening for tumor markers, AFP, and HCG. So the symptoms for people that are born and it wasn't discovered prenatally would be abdominal distension. They can actually feel the parasite moving, difficulty feeding, jaundice, emesis, and dyspnea. The most common location is in the retroperitoneum. About 80% of the cases are located there. It can also be in abdomen, cranium, the mouth, the neck, pelvis, or scrotal sac. Here's a cross-section image of a FIF cut open. Shows a thoracic cavity, a peritoneal cavity, and evidence of intestines and a spine. Some intestines. Here's another specimen. It's fairly well-developed fetus, and it's lying on its back with rudimentary digits. Let's see, so here's some cases. Case study 1. A 29-year-old patient came in for her first ultrasound at 34 weeks gestation. The ultrasound found a mass anterior to the left kidney. It was an encapsulated fluid-filled sac. The head contained a midline falx with no other neural tissue seen. A well-developed spine, 2 lower extremities, 1 leg had a club foot, 2 poorly developed upper extremities. Spontaneous movement was seen. No heart seen, but there was a small feeding vessel. So after birth, MRI found an artery from the SMA was providing blood to the parasitic twin, but there was no venous drainage. The newborn underwent surgery, and the fetus and fetu was successfully removed. So here's the ultrasound from that case. You can see the arrows pointing to the midline falx, but there wasn't really any brain tissue seen. And this is the host twin. You can see the normal like liver and bladder here. Here's a little fetus V2 inside of the host. You can see there's like a little artery feeding it there. Here's a neat 3D ultrasound. You can see the legs stretched out and the feet. And this is actually a pretty well developed one from a lot of the studies I've seen that actually kind of resembled a little bit of a fetus. And here it is after they removed it. You can see the kind of face structure a little bit. Here's a umbilical cord starting, possibly some arms and little leg-like structures and feet. So yeah, it was pretty well developed. Here's a cross section where they cut it open, and you can see the trunk exposing the internal viscera, and the head lacks a skull, which is pretty common. Let's see, case study 2, 19-year-old patient, 29 weeks gestation, referred for an abnormal neck mass seen on a prior ultrasound. Sonographic findings were complex cyst in the fetus's left neck. The mass contained solid tissue and bony elements. The MRI confirmed ultrasound findings. After birth, the mass was surgically removed on day 2, and pathology exam showed 2 appendages with rudimentary digits, vertebral column, and immature intestines, lungs, adrenal, and muscle tissue. Here's the ultrasound. You can see this is the baby's head, and this is the posterior neck, and this kind of like bulges off of there, and these are some echogenic long bones seen by the arrows. Here was the MRI. You can see really well. The baby's looking that way. Here's the mass, and these are the solid components inside the cystic neck mass. Let's see. Specimen, you can see a recognizable foot and malformed appendages, the arrowhead, and areas of skin and hair. Check out that hair. Nasty. Last little bit, some facts. It's an extremely rare disorder. There's less than 200 documented cases, increased incidence of twinning in families of infants with fetus and fetu, and there's a 2-to-1 male predominance. And that's it. Thanks, guys.